My name is Brian Chalmers. I'm one of the hip and knee surgeons at the Hospital for Special Surgery. So I see patients with hip or knee pain either in a native joint or unreplaced joint, and that's predominantly from arthritis, which is wear and tear of the cartilage over time. I also see patients that have already had a hip or knee replacement that are still having pain or discomfort or issues and may be a potential candidate for a revision or redo of that joint replacement. So I try to take a very individualized approach to patient care. I really try to get to know patients in the office visit, what their history is, what activities they want to try to get back to, and what their ultimate goals of their hip or knee is, and how much they're limited in doing those goals, and really with the patient come up with a comprehensive strategy to try to get them back to what they wanted to do. So some of those treatment strategies might include physical therapy, modifying your activities, medications like anti-inflammatory medications and other alternative types of medications, sometimes injections into the hip or the knee joint. And ultimately, if those aren't working and patients are still having a lot of pain and a poorer quality of life than they would like, then we talk about hip and knee replacement surgery. I use a lot of robotics and computer navigation during hip and knee replacement surgery. While I'm still doing the surgery, it's a very powerful tool to help us be much more precise and accurate and give patients an individualized or more patient-specific hip and knee replacement, and really I think just making a good operation even better. One of the most rewarding things about my job is seeing patients improve after surgery. Most of our patients have a lot of pain, even with daily things like walking and stairs, and can't participate in the activities they want to, like sports. After surgery, even after just a couple of weeks, most patients are walking and doing most things they want to do without any pain, and even after a couple of short months are back to a lot of the high-level activities that they like to do, like golf and tennis and skiing and other activities.